YouTube. Okay, I'm live on YouTube. Hello. Hello, YouTube. Hello, TikTok. Good to see you guys here. Today is August 26th. Today is the sixth year anniversary of my good friend's passing, Betsy. So I want to just take a moment to say that she died of cervical cancer. She was up to date on her pap smears. She had a normal pap smear with positive HPV, had a colposcopy, normal. A year later, she had cancer that was aggressive. Right away, within a week of her being diagnosed, we had her in with an oncologist. She had her hysterectomy within a week. It had microscopic invasion to her lymph nodes, and she ended up getting chemo and radiation. How's my sound, by the way, guys? Because I had a problem with I had a problem with my microphone last time. So can you guys let me know if my sound is okay? But anyway, just wanted to take a second to say about cervical cancer, whatever you think about it, there is screening, there's a vaccine. Oh, thank you, Tracy. I had a problem with the microphone last time, so I just want to make sure before I rambled on. But anyway, cervical cancer awareness, because today is the 6 years ago Betsy passed away. So I just want to take a second, make sure you're up to date on your pap smears. Right now, the recommendations have changed as far as how often you need to get pap smears because of the HPV, because we need HPV. And think what you will of getting vaccines or not, but we're going to go right into questions. So thank you, Chrome Stella. This is why I'm here. I am here to answer your questions. And for those of you that don't know me, I'm a traditionally trained doctor, and I'm not your doctor. So I'm going to try to answer your questions as best as I can without giving medical advice, because that's what we've been advised. Okay, Chrome Stella, is having painful periods normal? I've been in naproxen for a couple of years now. I'm wondering if I have endometriosis. So the question is it getting progressively worse? Is your painful period, one, getting worse, two, not relieved from the naproxen? That could be a symptom that you do have endometriosis. And right now, the only way to diagnose endometriosis is by having a laparoscopy. However, there is some set about maybe trying to find a blood marker or trying to find some kind of clinical, like some criteria. So I suffered from painful period for many, many years, took naproxen, ruined my gut, ruined my stomach, had to get not ulcers, but something else. And then I wasn't diagnosed till I was 30 and had a laparoscopy. For those of you joining in, let me know, where are you joining from? I'm broadcasting from Ohio, 7 p.m. Eastern. We usually do a tune-in Tuesdays whenever I'm in town. I know that I do a lot of teaching in the fall. It seems that's when conferences are. So it is going to be a crazy travel schedule for me. So I'd love to hear where you guys are joining from. I'm headed this Thursday to Austin to record some content for physicians, and then I'll be in the Grand Canyon next week, so we won't have live next week. Have any of you been to the Grand Canyon? Wondering if you have any of your steps. And while I'm waiting for questions, if any of you are beauty people out there, can you let me know what I can do for my dark spots? I mean, these dark spots are popping up. You know, I'm thinking of making a video and putting it on and see all these beauty people that can tell me what their products are. I've tried a couple different things. So if you guys have anything, or maybe even a good cover up, because it just seems like I'm not getting that. So for those of you joining, as I mentioned, I'm taking questions to see if I can help you with your questions about women's health, GYN, mostly hormones. So the follow-up, Chrome Stella, can you have endometriosis if you only get pain during your period and not in between? Yes. Melissa, Genoin cream. Okay. So I think that's the same thing as what I've been using, but maybe I'm just not using enough. So thank you. I found this stuff called conjic acid. So I've been trying that. Okay, beauty is for maybe you just joined. I'm just asking, what can I do for my dark spots? But this is supposed to be me helping you guys. Okay, wellness with mama. How to reserve burning skin in perimenopause? Great question. A lot of time burning skin, and I'm wondering where is the burning skin, is from low androgen. So low testosterone or low DHEA. People can get a burning mouth, really dry eyes. So it's usually a low DHEA. And what I found in some people who are getting into the hormone space, they're doing a better job about checking estrogen and progesterone, testosterone, even, but really not getting into the DHEA and DHEAS. So that could be potentially where you need to get checked. It's on the arms, neck, and back. Okay, so wondering if that is a result of you having low androgens. What can you do for it? Gosh, again, some people are using coconut oil, a lot of great moisturizers. I just started using, not necessarily my arms and back, but beef tallow. It's a really emollient. But what I saw from a dermatologist or someone, they said, well, it doesn't moisturize, but it traps moisture. So you still got to use the moisturizer underneath. Beauty is her name. Does HRT cause frequent urination in the beginning? Not usually, but the lack of HRT does. So wondering if it's a timing that you had that. Um, and it could coincide with you starting it and you having those symptoms, but that's not usually a cause. Um, Wondering if you guys also had any other questions about younger hormone questions. Sarah Faye, there you go, like on cue. What are your thoughts about endometrial ablation, pros and cons? Okay, well, endometrial ablation is a non-invasive, meaning there's no incision. You do have to have an anesthetic, and generally it is a general anesthetic, not the breathing tube, but you do what's called an LMA mask. You have to be put to sleep, and we put a device in your uterus, and it expands and burns the uterus. The last I've done it, and I haven't really operated in 10 years, but at that time it was 90 seconds. So pretty safe, very low risk of complications about 1% of the time. However, a lot of times you're having this excessive bleeding, but that isn't treating the cause. It's treating the bleeding. Like, say it's because you have high estrogen and low progesterone. You have the ablation, you don't have periods anymore, but you still probably have the hormone issue. So then, you have to make sure that you're getting that treated as well. User 408-5196, is it safe to cut the patch in half? So I think for short time, yes. But I don't know about a chronic dose, but the manufacturers and the pharmacists will tell you no, but I do have patients that are able to cut the patches in half without a problem. Ardent, do peptides affect hormones? Well, there's a lot of peptides, and it depends on which one. So I don't know if you want to give me a follow-up question that maybe can tell me what you're talking about. Wellness with Mama, they told me estrogen could impact that due to the nerve connection was placed on estrogen. I haven't had that in my patients. I've prescribed it to thousands of people, and I've had the opposite. People have frequent urination, and they're better once they get estrogen. Oh, Sarah, okay, you just had an ablation. Okay, I'm glad. Sometimes you really have to have an ablation, right? And I loved the procedure when I was operating because it was low risk and it was effective. But I was always still measuring hormones and balancing. So I'm so glad you needed to do that probably to catch up. And I'm hoping that you are now on a mission to figure out your hormones. So thank you. Okay. Any other questions coming from YouTube? Wondering if anyone is watching on YouTube. Peace. My liver's having a hard time on a 100 microgram patch and 200 utrogestin. My hair is falling out. I was told burning skin could be for the drop of estrogen. Yes, that is also true. Also, the drop in androgens. Peace. Back to your question. That So I'm wondering what your androgens are. If you have low DHEA or low testosterone, that can also cause your hair to fall out. Something like DIM or I3C or sulforaphane. God, I keep itching because I think I got a mosquito bite. It's really itching right now. So sorry. So peace, that could be something that could be helpful. Chronic health, true love, seeing you next month. Yes, gosh, you know what? We're always having cancellations. I don't know if you had we're on the list or not, but I'm going to be happy to see you and happy to meet you. Peace, I'm on Testogel. Okay, so I'm not sure what that dose is right off the top of my head. So the highest dose patch plus the Testogel, maybe a lot of that could be backing up if you're slow to metabolize. Testosterone and estrogen are metabolized the same way. So it could be that some of your pathways are sluggish. and that's maybe why your liver's having a hard time. Some of the things that we love for estrogen detoxification is, like I said, DIM, magnesium, B vitamins, um, calcium D-glucarate, sulforaphane. Those are great things to help your estrogen detoxification, and NAC. All right, nobody's really told me where they're joining from. I'm just wondering what time zone everyone's in. I'll be in Pacific time, I think. Phoenix doesn't change their clock, so I'll be there next week. Super excited about going back to the Grand Canyon. Haven't been there for over 25 years. And I was just there for like a day or so. So we're really excited about doing that. Okay, bunch of you joining. I'm here answering your questions. It makes you feel better, Ohio. Thank you, Johnny. Yes, it does make me feel better. Thank you. Doc Norman, San Francisco. All right, Boston, Art at 7 p.m. Thank you, guys. Yes, it does make me feel better that people are there and letting me know where they're from. I'm just curious if people are, if what the best time is. Thank you, San Francisco. You are joining in before dinner. 7 p.m. seems like a good time for Eastern time. May not be the best time for Pacific time. Um, the other thing I had kind of started talking about cervical cancer and screening, but I also wanted to let you guys know that there are some other things that have been linked with cervical cancer. One of the things that has shown a slight increased risk of cervical cancer is the longer you use oral contraceptives. And some of those studies, it's a small risk, but it does show that you could have an increased risk of cervical cancer regardless of what your HPV status is. And I don't know that people are really told that in addition to the breast cancer. Again, small risk, but increased risk. User 4085196428. Have you heard progesterone is bone protective? Yes, I actually had to prepare an osteoporosis lecture. I'm teaching for the integrative medicine and functional medicine fellowship out of the University of California, Irvine. One of my topics was osteoporosis, so I did have to dig into the data, and there are some studies that show that progesterone is bone protective, testosterone, DHEA, and also estrogen. Estrogen actually doesn't build bone, but it prevents the breakdown. And some of the studies are showing like DHEA, testosterone build bone, and possibly progesterone more of a building. Estrogen prevents the breakdown. It works with a receptor called rankle. Okay. Wendy Mines, how do I know if I knew to take magnesium? Wendy, great question from YouTube. There are not many people who don't need magnesium. So it really depends on what your symptoms are. Some people do measure a magnesium. They measure an RBC magnesium because just the serum magnesium is not very accurate. Emily, thanks for joining on YouTube. Could my menopause supplement be making me feel funny and sick and tingly? Well, it really depends on what your supplement is. Some of them have maybe valerian for sleep or something, so it could make you feel tingly. Some people respond that way to B vitamins, depending on what your metabolism is. Wellness with Muna. Can I take DHEA? I have low testosterone per lab. Could that help with burning skin? Well, as always, Wellness with Muna, we really like to get levels before, but if you don't have a provider that's suggesting that, it's probably okay for you to take it. I don't know your history or I don't know your situation, but there's a lot of really positive studies about it. A supplement that is a reputable lab that does third-party testing to make sure what's in it is actually what's on the label, and also start low with 5 milligrams for women. Lily Lopez, I'm 27. I never got a pap smear due to my SA. I will be affected if I don't get it checked. Um, I I know that you have to do the best for your situation, Lily, but at some point you're probably going to need to get a pap smear. So I mean, I guess do the best you can and find a provider that's patient with you. Emily from YouTube says, putting me out, but overall, I do feel better. Yeah, I don't know what the name of the supplement is, Emily. I might know offhand what's in it, but you can list the name if you want. How do you feel about testosterone brain fog considering I have PCOS? So user 408519. So normally the definition of PCOS is high testosterone. I usually see the opposite. I see low testosterone causing brain fog. But people with PCOS have low progesterone, and they also sometimes have cortisol issues. So that could be the reason for your brain fog. Yes, Lily, you're welcome. I hope that you can find a provider that can work with you. Okay, Peggy Brady. I think my doctor put me on a way too high a dose of testosterone, and my red blood cells are too high. So yes, we do follow your hematocrit and your hemoglobin, and when they do go up, that is one reason. Peggy, do you know the dose that your doctor put you on for testosterone, and how did they give it to you? Is it in a topical cream? Okay, in the meantime, user 408 increasing from zero point 0.5 patch to 0.75. When would an increase be to 100 to 200 be needed? So usually around that area is what we do. Some of the studies do show that the higher the dose of the estrogen, you're better off on the 200 dose of progesterone because it's just not very well absorbed orally. Chi Town Silver Girl, been on progesterone for a month waiting on Dutch results. Is there a disadvantage to progesterone only? No, not generally, especially if you're still having cycles, Chi Town. But also, if you're not having cycles and you're remote from your period and your estrogen is very low, you do need some estrogen to get those progesterone receptors ready. And sometimes progesterone out of balance to estrogen can promote poor sugar metabolism. But that's the only like kind of downside, and that's rare. Mark Jefferson, Marcy Jefferson says, does topical DHA help with testosterone levels much? So that's really a great question. If you're talking about topical DHA just on the vaginal mucosa, that's usually considered local and wouldn't normally increase your testosterone level much. But if you do put it on your skin and it is formulated for transdermal absorption, possibly yes. Peggy, thank you for giving me the dose, 10 milligrams. I don't know if 10 milligrams equals 2 clicks or 10 milligrams per ml, but 10 milligrams in my protocol is a high dose. We know that the male testes makes 5 to 8 milligrams a day, and the ovary, when it's young and healthy, makes a third of a milligram a day. So if you're taking 10 milligrams a day, yes, you have to assess for, you're not absorbing all 10, but it might be too high of a dose. Mom loves fashion. Does an estrogen patch cause yeast infections? So some people who are on estrogen only can get a little bit out of balance and have yeast infections, but generally no, estrogen patches don't. But there's something going on with either your microbiome or your gut or something like that. Okay, chronic health, true love. Could waves of dizziness and racing heart be symptoms of perimenopause? Absolutely. So the dizziness more commonly is when your estrogen drops right before or the first couple days of your period. That's just a common thing, but it could be really any time because it could be a cortisol thing. Racing heart rate absolutely could be high estrogen, and we see those swings in perimenopause. Oh, Chai Down Silver, see you in October. I don't know if you're coming to me or I'm coming to you because I'm coming to Chicago for a conference, but I would be happy to see you. Marcy, how do you know if you're at balanced estrogen and progestin correctly? Well, first of all, I hope that you're actually taking progesterone and not progestin. Progestin to me means a synthetic progestin, like a birth control pill. So there are added risks to that aren't with micronized progesterone. So it's very nuanced. So there's a couple things. One, that you're not bleeding. Two, that your symptoms, we know by taking a symptom assessment that you're balanced. And three, we know based on your levels. And it depends on how you're taking it and what kind of levels you do. Which leads me into the next question, Laura. Thank you. How do you get your hormone levels tested? So 99% of our patients, when they first come in, we start with blood testing. If you have ovaries and are still cycling, definitely blood testing is the first thing that we do. Now, the tricky thing is if you don't have ovaries and we know that you're not getting estrogen from your ovaries, the blood levels may not be the best. Now, it depends on what hormone you're talking about. If you're talking about thyroid, if you're talking about insulin, glucose, if you're talking about those levels, those have to be in the blood. Now, what happens if you have ovaries removed? How do we check? Well, we either do saliva, usually saliva, but we also can check estrogen levels in the blood as well. We can account for purple conversion. So it really just depends. And if you're someone who's taking hormones, then the way we test is different. It depends on how you're taking it. Lala 6, can pregnenolone increase estrogen? So that's a great question. So if you look at the science of the adrenal gland, there are different zones: zona reticulatus, zona fasciculata, and I'm blanking on the last one. There's like a cortex and the adrenal cortex, and gosh, there's another zone. Okay, so no, pregnenolone does not go to estrogen. So pregnenolone is in like kind of like the left zone of the adrenal gland. It can make cortisol, cortisone, maybe DHEA, but estrogen comes from testosterone, that comes from DHEA through androstenedione. So short answer is no. I've been told I get too sciencey, so sorry for that. So Cal Charm, what do you recommend for bloating with Combi Patch? I started HRT on Thursday. Probiotic. Okay, well, great question. So first of all, I'm glad that you're taking a transdermal estrogen, but the Combi Patch does have a synthetic progestin, and that alone can cause the bloating. But in the absence of being able to take anything else, a probiotic could help. All right, let's see. Um, Let me go back. Okay. Beach Gal, 64 years old. Is it too late to start hormone treatment? Great question. The guidelines say between 50 and 60 or within 10 years of your last period. So I wonder when your last period was, Beach Gal. I'm 56 and I had a period this year. So if I was 64, I could still start it. Now, that's not a hard, fast rule to never start it, but you do need a full cardiometabolic workup before being able to do that. OSGs, do SSRIs affect estrogen levels? That is a great question, also. And I do not think that's the issue, but estrogen affects serotonin. But I don't think it's the other way around. But I can't say for sure. I don't want to tell you anything wrong. User 7627, hysterectomy at 30. Oh, ovaries out as well, I'm guessing. I have been on estradiol since. I'm a 71 now. Should I also be on progesterone? Well, this is an unpopular opinion of mine based on several studies, none of them randomized, most of them observational or case cohort, that show the longer that you take estrogen only, you could have an increased risk of breast cancer. One of them is the E3 EPIC cohort that was published in 2008. In Breast Cancer Translational Research Board. The second was a nurses' health study. They had 122,000 people. The longer you were on estrogen alone, you did have an increased risk of breast cancer. I'm also wondering if you are feeling okay without progesterone all these years. Christina Lynch, thank you for sharing the live. Sandy, thanks for joining. I'm having some nasty internal itching that has sent me to the ER 2 times in a month. Estrogen. Could be estrogen, but also take a look at Seed's new probiotic, VSO1. That it could be the vaginal thing. And the second thing I love for vagina and those issues is Julva. Julva is available. I don't think I have a link to either in my bio, but Julva, Dr. Anna Quebeca, the girlfriend doctor, formulated that. That's mainly for external. Peggy Brady, thank you for the rose for whoever just gave that to me. Thank you. Peggy says, thank you. If I lower the dose, my red blood cells go back down. So I would definitely consider, I think you're the one with the 10 milligrams. Yes, usually that's what happens, is a lower dose and maybe less frequently. Oh, Marcy says you're not too science. Okay. Well, you know what? I'm a geek. I'm a science geek. And also, I think that's what maybe some people want to know, the why, right? And I'm a detail person and I like to be able to back up what I say with evidence and science. So thank you. Chai Tone Silver Gold, 56 and migraines have started. Yes. Okay. So if your migraines have started at your age, Chai Tone, I'm thinking most likely the drop in estrogen. Also, I just as often as seen low DHA. So we're going to check all of that. User 81089, hormone induced anxiety. Great question. Hormone induced anxiety. If you're still having cycles and they're fairly regular, it's low progesterone. If you're starting to skip cycles or they're getting heavier in your perimenopause, it's high estrogen, also low progesterone. If you've suddenly stopped your periods and you skip them, low estrogen. Isn't that confusing? I mean, it could be any of those combinations that is causing you to have anxiety. And that's why this is just so complicated. And I've spent my life's work studying this. I just realized today that I graduated from medical school over 30 years ago, 1993. and I finished my residency in 1997. No, 1992. I graduated from medical school. Okay, Chai Town Silver event. Actually, I don't have an event to the public. We're speaking. It's a for doctors, for prescribers. Okay, smiley me. I did a Dutch test and both my estrogen and progesterone was very high. I have really bad anxiety. Okay, so magnesium, B vitamins, SAMe could be helpful. I'm wondering about this high progesterone. I'm wondering if you took it. That's interesting. Um, I keep getting a message. I'm supposed to let you guys know that you can get daily bonus points. I'm not sure what that means. Okay. What happens when progesterone 200 to 300 makes you wired just by taking it 2 p.m.? Sandy, great question. So you take your progesterone at 200 or at 2 p.m. and you're wired and you can't fall asleep. So that means that okay, so we're going to get sciencey again, guys. Progesterone, when you break it down and take it, it breaks down to allopregnanolone. Allopregnanolone like presses start to the GABA receptor, which GABA usually makes you chill. However, some people, they have enzymes that convert GABA to glutamate, which excites you. Okay. GABA and glutamate are one enzyme away. That's GAD. And people have genetic mutations of it. So that's why it's a rare thing, Sandy. I'm wondering if you might do better with a troche in the morning, a dissolvable type, so that you take it in the morning and then maybe you're not wired at night. But that might be why you're doing that. Thank you, Tess, for the roses. I don't know what it means. Okay, Josie, question for you. Surgical menopause here near 2 years. Take HRT. I've been doing okay. The rest of your question, Josie, cut off. Surgical menopause, just as an aside, a lot of people have to also look at your um, androgens, your testosterone may decrease. Marcy, so I am bound for patients by the laws of Ohio. So what Ohio says is that any patient that wants to see me has to physically come to Ohio, have a face-to-face visit, and then for a year after, we can do telemedicine. So that's Ohio's law, not mine. We got another on YouTube. Okay. Huida, thank you for joining. Hello, do we need to do a saliva test before starting hormones or blood work? So that's a great question. I will tell you that if you look at the traditional protocols from traditional doctors, they will tell you don't need blood work and you can just start hormones and history is enough. For me, I would prefer to get baseline labs. You don't need to do a saliva test first. Cowlin, is low temperature around 96, 97 a sign of hypothyroidism? Yes. Random elevated prolactin should be rechecked fasting another time to make sure that it is low. Jessica, any advice for irritability and immune changes? Been on HRT for almost a year. Wondering, Jessica, how are your androgens? How's your testosterone? How's your cortisol? How is your sleep? What are your levels? But for irritability, a lot of times, if you're not sensitive to B complex, that can be helpful. Magnesium can be great, and saffron. Now, I have not personally tried saffron, but it's supposed to be great for mood. So, Jessica, maybe give that a try. Okay. Doorbell rang, Mr. Answer, 71 years old and estradiol since. So yes, in my experience, 7625 user, I never give estrogen without progesterone. And when you were when you were answering your door, I did cite a couple studies that showed that the longer you take estrogen alone, there could be an increased risk of breast cancer. But I know there's also some manipulations of studies they're saying there's not. So it's very confusing and it's very complicated. Marcy, Indy. Okay, so we are 5 hours from Indianapolis, 4 hours from Indianapolis, maybe six. We're in Akron, Ohio. It's not far. I know it's drivable. Okay, Belinda Morham. I have a pellet, but my testosterone is still low. Could the doctor send me extra testosterone? So yeah, that's an option. So if you have a pellet inserted, obviously that's surgically implanted. It's going to be in there for 12 weeks. And if they started with a lower dose, which I think is not a bad idea, then yeah, you could definitely take some extra. Okay, Wellness with Mo. They did all blood hormone tests, not saliva. Still accurate. That depends. Wellness with Muna are they measuring the levels in your body or are they measuring what you're taking by a topical cream? I don't remember how you were taking it, so it really depends. Barrow, 49 periods become very light. Yes, that could be the beginning stages of the menstrual changes of perimenopause. Okay. All right, we have just a couple more minutes. So if you guys are just joining in, for those of you that are still on, I want to tell you a couple things. Please sign up for our newsletter. It is free. It comes out every Tuesday. There is a link in my link tree here. Second, if you're not following me here, please follow me here and please go to my YouTube channel. I think it's so much easier to search for videos. I have tons of content on YouTube. It's Tara Scott MD. We have some new free resources for you. We have a natural guide to mood disorders. That's a download. Link is in my bio, or you can find it on my website, Dr. Tara Scott. Also, what a guide to not perimenopause, but a guide to hormone testing. Okay, a lot of questions today were on testing. We put it all together in a guide for you. Free download. Go to my website, go to the link here and download it. And is the advocacy checklist up?
I think so, yeah.
I think the other thing we were trying to put up is like questions to ask your doctor. All of those are free. We also have a free hormone course. Now, there's also a paid hormone course on there that goes in way, way, way depth. So those of you that appreciated my science, check that out. Those of you guys that want to just watch some quick content, that's also free. Go, and I have a team that is trying to spend all this time putting it together for you guys. So I hope that somebody is going to benefit from that. Okay, I have a few more minutes for some from questions. So V Winaz, is it okay to use low dose estradiol cream and 70-30 bias? So first of all, 70-30 doesn't tell me, is it estradiol and estriol or estriol and estriol? Which one's 70, which one's 30? And what kind of estradiol cream are you talking about? Vaginal? Chi-town, you're right. I know. I think we should get some kind of like not state law, but national law. And I don't know if that's changing, but thank you so much for your kind words. Oh, wellness, you haven't started HRT. Okay, so I'm guessing wellness with Luna. If you still have your ovaries, you definitely can probably start with blood testing. Okay. Okay, Sarah, you're welcome. Beach vibes. What dose estrogen do you like to start? I usually start people in perimenopause at the lowest dose, 0.025. Sammy, palpitations. You could try a couple things. You could try L-theanine. You could try Pharmagaba. Okay, those might be things, and also magnesium could be some things. Oh, so-called charms. Thank you. Olga, I'm on progesterone, but still have night sweats during ovulation and before period. So, Olga, your hormones are constantly changing, and it could be the dose, or it could be also that your estrogen is fluctuating. Tina, Love, and Will, you did the saliva test. Okay, great. I am a big fan. Angie, what type of magnesium? So for palpitations, I would probably do something called Neuromag or magnesium L-threonate. But I think you weren't the person that was having palpitations, but Sammy, that's something that you could try. Angie, also general magnesium, magnesium glycinate is a good supplementation as well. Beach Vibes, would you modify the dose of estrogen to be higher if we have osteoporosis? Great question, Beach Vibe. So what I would do is a couple things. This is how I manage my patients who have osteoporosis. One, I look at some bone markers that people don't usually look at. We look at a bone-specific alkaline phosphate. We do look at a bone density, but we also look at a P1NP, which is a marker of bone building, and CTX, which is a marker of bone breakdown. So we want to know, is the building more than the breakdown? And then there is some data that has been published on what level your estrogen level should be for bone protection. So we would look at that. Orion lost a lot of hair. Yeah, that could be low estrogen, could also be low testosterone. Tina, you got started on 3 creams, so I'm guessing estrogen, progesterone, testosterone. Okay, GG Rocks, estrogen dropped from 62 to 31 and 4 months even with HRT. Your body is constantly changing, and that's why we are always assessing the levels. Was on time lows for osteoporosis for 2 years. Not really sure what that is. Angie, will magnesium complex do? Yes, like a what's the one that I take? BioOptimizer's chelate. Yes. All right, guys. All right, my battery is on its last leg, so I'm hoping that you guys heard me about all of our free downloads. We have the free downloads that are in the perimenopause guide for testing natural antidepressants, the advocacy guide, the free the free course, hormone course. And remember, we have our free um, target, our free, what was I talking about? Oh, advocacy checklist and our free newsletter comes out every Tuesday. Okay, so sorry if I didn't get to those last couple questions that came in, but I have been going all day and my battery is about to go out. So I am glad that you guys showed up today on Tune In Tuesdays. Next Tuesday, I will be off. I will be traveling and I'll hope to catch you in a couple of weeks. Oh, got 2 cents.